नमस्कार समय सन्दर्भ लिएर आएकी छु म सोनिका आर्याल। दर्शकवृन्द, आज वर्ल्ड किडनी डे। किडनीको स्वास्थ्य र किडनीसँग जोडिएका समस्याहरू र यसका समाधानका उपायहरूको बारेमा कुराकानी गर्नको लागि आज हामीसँग स्टुडियोमा प्रोफेसर डाक्टर डेभिड टल्बट हुनुहुन्छ, जसले विगत 35 वर्षदेखि इङ्ल्यान्डका विभिन्न अस्पतालहरूमा किडनी विशेषज्ञका रूपमा काम गरिसक्नु भएको छ र नेपालमा पनि हरेक वर्ष विभिन्न हस्पिटलहरूमा स्पेशली मेडिकल कलेजहरूमा उहाँले एज अ गेस्ट लेक्चरको रूपमा आएर पनि योगदान दिइरहनु भएको छ। हामी आज किडनी रोग र किडनी रोगबाट बच्ने उपायहरूको बारेमा उहाँसँग कुराकानी गर्नेछौँ। Welcome to the show.
Thank you very much, Sonika.
How are you doing?
I'm good. I'm good.
Okay, today is World Kidney Day, and the coincidence is the Prime Minister of Nepal recently went through kidney transplant for the second time. We will come to that later on. Let's begin with what exactly causes kidney disease?
Well, there are a number of different causes. Diabetes is one of them, and high blood pressure. But there's also autoimmune conditions where your body attacks your own kidney, and that destroys it basically. And stones. There's several causes for kidney failure.
That is after was somehow one type of disease already attacks your body, and is it possible for a human being to prevent kidney disease with exercises, maybe with the lifestyle, maybe with the food habit, or a proper diet?
Well, I think it's difficult to prevent the disease, but you certainly is good for you if you have a good diet and you remain thin and you look after yourself. That's good for you in general. But once you get diabetes, say, it's a good idea to lose weight and try and be relatively thin, so there's less work for the kidney to do. Because as we put on weight, we have more muscle, because we need more muscle to carry ourselves around, and that generates the compounds that the kidneys have to excrete. And if the kidneys can't do their job, then you have a build-up of these compounds in your bloodstream, and that's not good.
Okay, we will talk about the kidney disease and the prevention later on as well. So, you have been practicing kidney disease since last 35 years, and as I mentioned earlier in my starting opening as well, you have been coming here in Nepal as a guest lecturer and stuff like that, and you have been practicing medical here as well. So, what is exactly your relation with Nepal and Nepali medical industry?
Well, it started with a gentleman called Pukar Shrestha, who was a trainee in transplant surgery, and he always wanted to do transplants in Kathmandu and to fix the people of Nepal, which I think is a great thing. So I encouraged him. We trained him in Newcastle, and when he came to Nepal, we came and helped him when he first started, which was back in about 2008, 2009. So it's been going on for a long time, and that was at the Beer Hospital. And then since then, he's moved to a separate unit, the transplant centre, to carry on working. And meanwhile, another colleague of mine, a chap called David Francis, who also came from Newcastle, he worked in Australia, and he got a similar relationship with the teaching hospital in Kathmandu. So both units developed in parallel.
And that is somehow working as well. Recently,
yes.
The Prime Minister of Nepal went through his kidney transplant. That is for the second time in Kathmandu itself. And the doctors who were involved in his kidney transplant say that he is completely fine now. And, I always wanted to ask, how often does this happen? He went through kidney transplant for the second time, and he is completely recovered now, as doctors said. So, how often does this happen? Is it normal for every people to get back in regular job, regular life after kidney transplant in second time, or there is risk as well?
Well, I mean, the thing with kidneys is we like to think that with a kidney transplant it'll last forever, the rest of their lives. But sadly, I always think the best analogy is to describe the kidney as being like a tyre, and it tends to wear out eventually. And then it's not unusual to have to do 2, sometimes 3 kidney transplants. And if you have your first kidney transplant when you're young, you can bet that you'll need another one before you've gone through your whole life.
Okay. Does age factor matter in this?
It's what, sorry?
Age factor matter in this? Like, you know, if you are young, you can have kidney transplant, and if you had done your kidney transplant when you are already, you know, over 40 or over 50, is it possible for that person as well to go through another kidney transplant?
Yes, yes. We've had, I think, the maximum number of transplants we've had in one person has been about 4. So yes, it happens.
Okay. What are the chances of risk in that?
Well, with the kidney, we normally place it in the iliac fossa, which is low down on the tummy. So you've obviously got a right side and you've got a left side. So everyone's can have 2 places. And then when you've done 2 kidneys and you need another one, you go back into the first one, or you go into the middle of the tummy and do it there.
Okay. So, as I mentioned, the Prime Minister of Nepal went through kidney transplant second time in a row. And how long do you think, you know, you have been practicing kidney since last 35 years? What your experiences say that how long does it take for him or for anybody who goes through second kidney transplant to get back in regular job and to be back in normal life?
Well, I mean, obviously you're asking because your Prime Minister is your Prime Minister, so you want your Prime Minister to be back doing his job.
That is true, of
yesterday.
course. That is true, of course. But at the same time, for anybody who goes through a kidney transplant, how long does it take for that particular person to get back in regular job?
Well, it's an individual question. It's difficult to generalize because whenever you have a transplant, things cannot go brilliantly. There can be problems, there can be infections, there can be hiccups along the way which sort of slow things down. But let's say you have a kidney transplant and everything works brilliantly. You generally get out of hospital after 1 to 2 weeks, and then you'd have follow-up probably about 3 times a week, which means it's difficult to maintain a normal job if you're having to keep coming back to the hospital. And that goes on for about 3 months.
3 months, okay. So it mostly depends upon the individual and his health condition.
Yeah, so in general, probably people would be back at work after 3 months. It hinges on what the job is. So if he's building a house, say, and he's lifting lots of bricks,
if it's physical work, then
it's probably not a good idea to go back to work too quickly.
Okay.
And the Prime Minister, I'm sure he doesn't do too many carrying of bricks.
Of course.
But he has other people to carry his papers. Maybe he could go back to work quite quickly.
All right. So normally what happens is in countries like Nepal, people don't go to hospital in normal, you know, in normal disease, not in simple problems. And what happens is we come to know that our kidney is not working in a very last stage, and the only option that remains is to transplant the kidney. So what is the symptoms, or how can a person know that the kidney is not working properly? You know, is there any way to know for a normal people who is not medical person, a normal people to know that kidney is not working properly in the very beginning?
Well, I mean, in the UK, we're quite lucky insofar as we have a health service, which means we cover everybody. But even with that, people present in the same way as they do in Nepal, is that nobody really wants to go to the doctor full stop, so they would rather stay at home. So occasionally we see people, probably like here, where they become unwell and they've picked up as having, say, high blood pressure, and maybe their urine output's dropped off, and they sort of know something's not right, headaches, and then they go to the doctor, and the doctor finds that their blood pressure is extremely high, and then they do a blood test and find that it's grossly abnormal. We had a gentleman recently who had toothache, and he went to the dentist, and the dentist took half the tooth out, and then he had pain, and they gave him some painkillers, and he went to the he went to the doctor, and they did some investigations and found out he had kidney problems. So you can present in a completely different way, but you pick up the kidney problems on the blood tests.
Okay, so there is not a proper particular way that we can find out the kidney is not working. So going to the doctor and checking our kidneys time to time is the only solution, as you say.
Yes, and
right?
blood pressure is a good thing, and urine testing to see if there's protein in the urine, and also looking for evidence of diabetes, high sugar levels, and so forth. Because all of these things, if you pick them up, you start on medicine for your blood pressure, or you start on insulin, say, for your diabetes, you can sort of stabilize it, which means that the kidney disease will stop getting worse. It'll fix.
Okay. The food habit and lifestyle, working environment, everything is different in South Asian countries, especially compared to developed countries like UK. Does that make any difference in diseases like in kidney disease, especially?
Well,
does lifestyle and
yes,
food habit?
yes is the answer, because one of the things with kidney disease is your biochemistry gets worse, and the best example is potassium. So your potassium goes up in your bloodstream, so the diet has to be changed, and you have to cut out certain things like bananas, fruit, cheese, and if you don't have a great deal of choice in what you eat, it's quite difficult. So it's far more difficult in countries such as Nepal to be able to suddenly stop eating peanuts, say, or bananas. You have to have something else to eat. You can't just starve. So it is more of a problem, I think, in how you would sort of live your life in Nepal with kidney problems.
Basically, the food habit.
Yeah.
Okay.
Or the lack of choice that you can afford.
Maybe that is also the problem.
Yeah.
So, you have been practicing medical kidney for the last 35 years, and as your experience says...
You keep reminding me.
That is very important.
I'm quite old, that's true.
No, I'm not reminding you that you're very old. I'm just reminding you that it's very important and you are experienced. That matters a lot. And what type of kidney diseases are there? Does every kidney disease requires transplant, or there is any other way as well?
Well, once you've identified the kidney disease, you would try and fix all the things that you can fix. So if the blood pressure's high, then you'd go on to medicine to bring the blood pressure down to normal levels. If the cholesterol is high, you'd go on to some statins, say, to fix that. And you generally try and improve the health of the person. So even though the kidney's not very good, it will be enough for that person. And then you watch them and you make sure that they behave themselves and everything is stable. But eventually what often happens is that person ends up in full kidney failure, in which case then they would need dialysis or a transplant.
What do you think should be done in countries like developing countries like Nepal in order to prevent or in order to somehow control kidney disease in common people?
Well, I think awareness of the problem is perhaps the most important thing. So if you say to yourself, how are my parents, say, and if your parents are very old and are doing well, then there's a good chance that you'll be all right as well. But if, let's say, your parents have died young and there's a problem in the family, it's probably a good idea to go and find a doctor to find out what your blood tests are doing and whether it's normal, and maybe keep an eye on things and have be suspicious if things aren't quite right, to actually seek medical help earlier. So what you're after is basically finding the kidney problem before it becomes, too late.
So if we find out, if a patient finds out in a very early stage, is it possible to treat him with medicine as well without transplanting? And
yes.
Is it possible?
Yes, but what it means is that period of time can go on for many years, hopefully, in which case you put off the moment when you need dialysis or transplant.
All right, all right. So what are the new practices that is happening around the globe in kidney transplant and kidney disease in recent years?
The first kidney transplant was done in 1954, so that was
a long time.
very long time ago.
Yeah.
The development that's happened since then has really been the drugs, the immunosuppressive drugs, and for live donor kidney transplants, the way you take the kidney out. So traditionally, you have a big cut in the loin, and you take the kidney out, and the person who donates the kidney has often quite a lot of pain in the scar, and they've got a big cut. So the development there has been keyhole surgery, and that's beginning to happen here as well in Kathmandu. So you actually put ports in, which are maybe 12 millimeters wide, and then you mobilize free the kidney up, and then the kidney is put in a plastic bag inside, and then is taken out through a much smaller cut, so that the person who donates a kidney has a lot less pain and is much more mobile more rapidly after their operation. And that's been a big advance, really. Other advances has been the cadaveric donation, that is people who die, and using their kidneys after they've died. And we've been doing that for a long time. But it's only just beginning to start in Nepal.
Okay, so you know, it is very important to find the right kidney for a patient as well, right?
Yes.
So donation is kind of new thing, especially in Nepal. People really don't understand the meaning of donating their organs as well. So
yes.
What do you want to say about in that, how important it is for a person to be donating their organs? It may save somebody else's life as well. So how important it is?
Well, death sadly happens to all of us. And it is inevitable. And when you die, and if you go to a funeral, they're very sad events, and people are all very sad. But if that person has been a donor, then there's something positive come out of it. So the people at the funeral, are pleased that in a way there's been a legacy, there's a transfer, and lots of people have benefited from it. And if the donor is suitable, it's not just the kidneys that are used. There's the kidneys, the pancreas, the liver, the heart, the lungs. So you have lots of people will benefit from that death. And though the death is sad, there is still a positive outcome from it.
Can donation be taken even from the person who died out of some kind of disease, like some kind of virus or some kind of disease? Is it possible to take out the organs from that person and put it in somebody else's body as well?
Well, again, you've got to be very specific, because what you can't do is take organs from somebody with a horrible disease, let's say Creutzfeldt-Jakob disease, or rabies, and give those organs to other people, because those other people will get the rabies as well. The viruses in general, people are quite frightened to use kidneys or organs from anybody with a virus. But there are antiviral agents now, so you can actually do it, say, with hepatitis C or hepatitis B. It is possible. And let's say with hepatitis B, if you've got liver failure, yes, you can use the kidneys, and you can use the heart and the lungs, provided the person receiving the organs has an antiviral treatment as well. So it's not impossible.
Okay. What is the condition of kidney disease in general around the globe right now?
Well, it's there.
Of course it's there.
The problem, say for example in Britain, is that as people get older, and the population is getting older in Britain, they develop more kidney disease. So the actual incidence in Britain is going up. So I think in developing countries where people don't live very long, then the kidney disease is probably static. But as Nepal becomes more profitable and people and the medical health system improves, then people will live longer, and therefore they will get more kidney disease as well.
Okay. Is there what kind of differences do you find in medical practice here in Nepal, or in South Asian or under the developing countries, and medical practice in countries like Britain?
Well, I mean, we're very spoilt in Britain insofar as everybody that works pays a contribution called national insurance to the health system, so that if we become ill, we go to hospital and we get treated for free. But in Nepal, it's very difficult. You know, you have to. There in some situations, such as dialysis and transplant, they've managed to get funding to help them with that from the government. But in a sense, that's quite unusual. And the patients, after their transplant, say they still have to pay for their own medication, and money's not plentiful here. So it is difficult here.
That is also, it's very expensive. You know, normal people cannot even afford that practice as well. And what do you think should be done? You know, what your experiences says. What do you think should be done in order to make it quite easier and quite not so expensive for common people and accessible for common people as well?
Well, what should happen, but it won't happen, is that the drugs here should be cheaper than the drugs, say, in Britain. But it won't happen because what the drug companies are frightened of is that they sell the drug to Nepal and then people export it back to the developing countries at cut down prices and make profits, and then the companies miss out. So it is a bit sad that that happens, because in a sense that would solve the problem, really.
Yeah. We've come to the almost end of today's show. At the end, what do you like to say to people, you know, in order to prevent or in order to be aware of kidney disease? Today's World Kidney Day as well. So what do you want to say to common people in order to take care of their kidney and not to go to hospital for a kidney transplant?
Well,
what should be done?
Keep your weight down. Think about what you're eating. Don't get overweight. Stay fit, and think about your family. And if you're worried, go and get some blood tests. But the other thing I would say is that the fact that the Prime Minister's had his transplant here in Nepal is a huge vote of confidence in the Nepalese health system. So I think that's just wonderful, really.
Okay, thank you so much. Thank you for coming here. Thank you for your valuable time, and thank you for your contribution in Nepali medical industry as well.
Thank you very much for having me.
Thank you. उहाँ हुनुहुन्थ्यो डाक्टर डेभिड टल्बट। हामीले कुराकानी गर्यौं वर्ल्ड किडनी डे को बारेमा, प्रिभेन्सन कसरी गर्न सकिन्छ र यसलाई किडनी रोग लाग्नबाटै बच्नको लागि हामीले कस्तो खालको उपायहरू अपनाउन सकिन्छ, यसै विषयमा रहेर हामीले आजको कुराकानी गर्यौं। समय सन्दर्भ आजको लागि यति नै। हामी भोलि फेरि पनि यस्तै समसामयिक विषयलाई लिएर आउने नै छौं। तबसम्मको लागि बिदा दिनुहोस्। नमस्कार।